All right, guys. So let's begin. Today's topic is bone tissue. So before we begin, I just want to say, for me personally, this topic is a bit, more of a understanding type than a memory type. Like compared to other topics, there is more of memorizing than understanding. But this topic, we will try our best to help you guys understand this. All right. So first of all, why is this topic important to study? So the obvious reason would be you guys want to pass your histology micro test. But other than that, in terms of histo, as you guys know, bone tissue has, different types of cells. This includes osteoblast, osteoclast, and osteocytes. And, it's important to know their role and function, which helps students grasp their roles in bone formation, maintenance, and reabsorption. And the clinical relevance of this topic is that bones are, involved in various clinical procedures such as fractures, orthopedic surgeries, as well as bone grafting. So when we understand the bone histology, this will help us in effective treatment and management of these conditions as well. So let's start. Ossification. Before I begin, I want to ask, what do you guys think happens to your bones as you grow from a baby to an adult?
They grow.
Yeah, they grow, and what happens to them?
They get mineralized, so they become tougher.
Yep, exactly. So, ossification is basically bone formation. Now, we have two types of bone formation. The one is desmogenous ossification, and then we have chondral ossification. So, desmogenous ossification is also called direct or intramembranous ossification, and chondral is called indirect or endochondral ossification. So, you can remember desmogenous ossification, DD, desmogenous direct ossification. Now, when we talk about the types of ossification, we start off with primary or secondary ossification. So when we talk about primary ossification, it involves the formation of primary bone, which is immature, membranous, and woven. So this is basically seen in the embryonic development. Bones basically form first this way. So during embryonic development, when the baby is being formed inside the mother's womb and all that stuff. And then in adults, this is seen in certain areas such as tuberosities, tooth sockets, as well as near skull sutures. Now, when we talk about the secondary ossification, it is the formation of a secondary bone, which is also called the mature bone or the lamellar bone. So, as we said, how bones get stronger as the child grows to an adult, this is the secondary ossification taking place. The bones grow, they mature, and they become more stable. Now, this is found in the mandible, maxilla, clavicle, as well as flat bones of the skull. So, just to summarize this again, desmogenous ossification is, we can take an example of a house. Desmogenous ossification is just directly building the walls of the house. When you talk about chondral ossification, we start off building the walls of the house by a temporary material like cartilage, and then this gets slowly replaced by a strong material. Yeah. So now, what is the difference between primary and secondary bone? The primary bones, they contain high number of cells, which are the osteocytes, which are just the bone cells, and secondary bone, it contains fewer osteocytes. The primary bone, they have more collagen fibers, which are arranged in an irregular way, and they have low mineral content in their ground substance. And this is the reason why they're not very suitable to handle strong mechanical forces. On the other hand, when we talk about the secondary bones, the collagen fibers, they're organized in layers and they're parallel to each other. And their ground substance is highly mineralized, as well as the fact that they're arranged in a way so that they can withstand high amount of mechanical stress. So basically, primary bone is, just a framework, and it is not the strong bone. It's just a framework for the mature bone that needs to be formed. Secondary bone is just the strong bone which will be able to handle the mechanical stress. So now the last point about the secondary bone is that this bone basically forms the Haversian system or the osteon, which is made up of concentric lamellae which surround these canals. So now I know this sounds confusing, but the next image will make this easy to understand. So yeah, here. So the white holes which you see here, these are called canals, Haversian canals or osteon, and surrounding them, this area is these are the 4 to 20 concentric lamellae which are arranged around it. And what limits this Haversian system are these lines, which are called the Smith lines, which separate one system from another. So, guys, any confusions regarding primary or secondary bone? Yeah, Hamza.
No, that was by accident. Sorry.
All right. So, moving on. Which one do you think is the primary bone or a secondary bone here?
Secondary is the one on the right.
Yeah.
Yeah. All right. Now we talked about the direct or the intramembranous ossification. So, direct or intramembranous ossification, it begins by mesenchymal cells which come together and form bone blastema. So again, in this case, we will take an example of a house. So mesenchymal cells would be, construction workers which come together and they lay the framework for the formation of this bone. This is why it's called bone blastema. And then step two would be these mesenchymal cells differentiate into osteoblasts, which secrete an organic matrix called osteoid. Now, what this means is, so as we said, the mesenchymal cells are construction workers. Now, they will differentiate into osteoblasts. So we can say these construction workers, they will, change into builders, which have a high profile or something like that, and they have a specific function now. They convert into osteoblasts, which secrete the organic matrix called osteoid. Now, these osteoblasts get embedded into the osteoid, now they're called osteocytes. Now, the osteoid is mineralized by calcium and phosphate, which turns into a hardened bone matrix. So the walls of the house again become stronger as calcium and phosphate is added. Now, these osteoblasts, they continue adding more layers to the bone, and this leads to the formation of trabeculae, which are nothing but thin columns of the bone, which result in the formation of a woven bone. After that, the bone grows and these trabeculae or the adjacent centers fuse and the bone becomes denser. And this is how the primary bone is formed. And now the remodeling takes place and the primary bone is converted into the secondary bone. So now to help it make more sense, we can look at these images. So first of all, as I said, these mesenchymal cells, they differentiate into osteoblasts, these cells. And then these osteoblasts, they secrete the matrix called osteoid here. And now, as you can see, the osteoblasts are outside and there are some which remain inside as well. So the ones which remain inside, they convert into osteocyte. And here we said the new bone matrix, which is, the calcium and the phosphate. And once all of this comes together, they form these columns called trabeculae, and then this leads to the formation of the primary bone. Now, in order to remember this, you can just use this mnemonic, which is med students cram so much, our bones feels wrecked, man. So mesenchymal cells, condensation, differentiation into osteoblasts, secretion of osteoid matrix, osteoblasts get embedded to become osteocytes, and then formation of trabeculae, fusion of these trabeculae, and then primary bone or woven bone, and remodeling, and then mature bone. So, guys, this is a bit hard to understand on the first time. So, if you guys have any questions, please, you guys can say. All right. So, when I was studying this, this was my reaction to this. But if you guys have no questions, we'll continue. Now, we talk about the chondral ossification. Now, I want to apologize for the amount of content which will be on this slide and the pictures, but I don't want you to get overwhelmed by this because I want to explain this like a story. Like, as I said, this topic is more about understanding than memorizing. So, chondral ossification, step one, a dumbbell-shaped model of hyaline cartilage, which basically forms a template for the future short or long bones. So basically what happens is this bone starts off as a squishy model, which is made up of cartilage, like a rubbery stuff in nose or ears. And this model has a shape of a dumbbell. That's it. And then step two, the outer layer of the cartilage, which is surrounded by the perichondrium, is surrounding the diaphyses, and this converts into periosteum. So what does it do is that it forms a hard substance called bony collar, which surrounds the hyaline cartilage. So you can imagine the soft substance, which is the hyaline cartilage. It is surrounded by the hard substance, which is the periosteum. Now, the bone collar, it continues to grow towards the epiphyses. Epiphyses are, the ends of the bones, okay? And the cartilage in the center grows through the interstitial proliferation. And this is why you can see the zone of proliferation. There are many cells, and the number of them is basically increasing. So as we said, the bone collar is basically present on the sides, which is the diameter of the bone. So what will happen is that this bone collar will stop the growth of the bone in terms of its diameter. So what this will do is that it will make the chondrocytes, like they will expand like this, like forming columns which are parallel to each other. So this will cause the length of the bone to increase, but not the diameter of the bone to increase. Then we have in the middle of the diaphyses, what happens is due to the bone collar again, the cells start to lose access to the nutrients, causing the chondrocytes to degenerate. They become degenerated and the space between them increases. All right. This is called the zone of hypertrophy. And you can see these white holes, right? These represent lacunae, which is where, the chondrocytes are present. After that, we have step 5. So as these chondrocytes grow, the space between them shrinks and starts to calcify. So as you can see, this end part here, the space is decreasing between the chondrocytes and it's becoming harder and harder. And this area is known as the zone of calcification. Someone raised their hand. What's the question?
Yeah, I wanted to ask, is this process only for hyaline cartilage or is it the same for other cartilages?
No, for bone formation, it's only for hyaline cartilage. It begins and then it will form the bone.
Thank you.
All right. Yeah. So just to summarize again, we have the hyaline cartilage, which is the soft center, all right? And then it gets surrounded by a hard periosteum. And what this does, bone collar or periosteum, and what this does is it allows the chondrocytes to form isogenous groups and allows the bone length to increase, but not the diameter to increase. All right. And now this bone collar will prevent the diffusion of the nutrients to the chondrocytes. This is why they will die and they will become enlarged. And then as these chondrocytes will grow, the space will decrease and the space will become harder and harder. And this is called calcification. Now, after that, what happens is that the calcified matrix, what does it do is that it blocks the oxygen from reaching the chondrocytes, results in them experiencing hypoxia. So now how the chondrocytes will respond to this is they will release some signals which will cause the growth of blood vessels in the area from the periosteum. So from this area, the blood vessels will enter and supply nutrients to these cells. So when the periosteal bud penetrates through the calcified cartilage, the mesenchymal cells will enter and they'll differentiate into different types of cells. These would be the chondroclast, which will digest the cartilage, bone marrow stem cells, as well as the osteoblasts. So, does anyone have any questions about this? No? So, just to summarize this again, we have 4 zones in this. We have the resting zone, zone of proliferation, zone of hypertrophy, as well as zone of calcification. So, resting zone, nothing is happening. We have the oval-shaped chondrocytes. There are no blood vessels. There are no isogenous groups. Zone of proliferation, number of cells increases, isogenous groups are formed, and they are arranged in parallel. Zone of hypertrophy, not enough nutrients, chondrocytes get larger, less ECM, which is the extracellular matrix, and as the volume of the cells increases. And then white spaces called lacunae, where the chondrocytes are present. As I said, the white spaces which were in between, these are the areas where the chondrocytes are present. And then zone of calcification, ECM gets calcified, becomes darker, and this zone is thin because as soon as it gets calcified, it gets eroded by chondroclasts. All right. So this was the summary about chondral ossification. And now Katerina will explain the endochondral. Just a second.
Hi guys. Just let me know if you guys can see this and can you guys hear me?
Yeah.
Okay, perfect. Now I know that this was a lot of information and it could get a bit confusing, so I'm just gonna Again, once again, just mention it. Can someone quickly tell me what are the two types of ossification?
Endochondral.
Yes, and
intramembranous.
yes. Okay, and do you guys understand the answer or idea of what they are is in the name? So intramembranous, we're starting with a membrane. We're starting with mesenchymal cells that are going to form a bone blastema. Chondral, do you guys know what chondral means? I know you guys have just started doing Latin, but do you guys know what chondr, C-H-O-N-D-R, what it
Cartilage.
means? Exactly, cartilage. So with endochondral and chondral, we're using first a cartilage model that we're then going to use to create our bone. Okay, first one, no cartilage, just mesenchymal bone blastema. Second one, there's bone. Now, there's a difference between chondral and endochondral. Even though both of them start with cartilage. With chondral, which is what we've just explained, we have like already a pre-existing cartilage model, and we can say that the cartilage is going to directly turn into bone. Endochondral, which is what I'm going to explain right now, there's a different process. We start with cartilage, but in this cartilage, there are two things happening. We have the cartilage being destroyed, bone being built, and then bone being destroyed, all happening at the same time. Even though you guys are going to talk about the different type of cells that are involved, I also know that it can be a little bit confusing because you keep hearing osteoblast, osteocytes, chondrocytes, yada, yada, yada. You guys understand that when we talk about chondrocytes, blasts, these are cells for cartilage. It's in the name. Osteo, we're talking about cells for bone. And when we talk about blast, we're talking about building. So osteoblasts are going to be building bone. Osteocytes are going to be resorbing bone or destroying bone. Chondroblasts are going to be building cartilage. Chondrocytes are going to be destroying or resorbing cartilage. Can anyone tell me what fibroblasts build? This was last week's, I believe, fibroblasts will be the title of your, if I'm not mistaken, your e-test or your micro-test. You guys had a micro-test on your last one, connective tissue, guys.
Fibrocytes?
Fibroblasts. Okay. Yeah. Anyways, connective tissue. And fibrocytes is just the inactive form of fibroblasts. Just putting this out there before we start so you guys don't get too confused. So now we're talking about endochondral ossification. And here we're just going to talk about the steps. So just try to follow through. If you guys get confused, just let me know immediately if you guys are lost, etc. So we have a cartilage model, right? We have cartilage. We want to destroy this cartilage first. So we're going to start with chondroclasts. Chondroclasts are going to destroy the calcified cartilage, and they're going to create what's known as a primitive medullary. After they destroy the cartilage, now we have this empty cavity. Blood capillaries are going to enter this cavity, and they're going to bring other elements with them, other cells, just a bunch of other things, nutrients, anything. And once you see these blood capillaries, this zone, so we have the cartilage, we have a cavity that the chondroclasts created. We have blood going inside this cavity. And this entire zone, we refer to it as zone of erosion because the cartilage has been eroded. When we talk about the blood capillaries entering, they're going to bring mesenchymal elements like osteoblasts. So now we have osteoblasts here. These osteoblasts are going to attach to the remaining calcified cartilage, and they're going to produce osteoid. Does anyone remember how an osteoblast turns into an osteocyte? So osteoblasts, they're going to produce osteoid, right? And then once they become attached to the osteoid that they produce, they're now termed osteocytes. And once we see this on our model, this is known as the osteoid zone. The reason why these zones are important for you guys to know is because you guys can actually differentiate these zones in the slide that you guys are going to have. You guys are going to be able to see the zone of erosion because you guys are going to see a lot of capillaries. You guys are going to be able to see the osteoid zone because you guys are going to see osteoblasts that are producing the osteoid. And once this zone becomes mineralized, and it becomes mineralized after the osteoblasts embed into the osteoid, this is now termed the ossiform zone. And you guys are going to see the first bony spicules And these first bony spicules, which I will show you guys what they look like, they're forming what we call the primary bone. And so this is kind of what I was explaining. It seems very confusing right now. I don't know where my mouse is. Oh boy. Anyways, okay. Okay. The area with the blue dots, right? That's a specific area. Does anyone know what that area is? Okay, I'm just going to, because I think this is going to be better if I have my mouse so you guys can kind of see. Okay, can anyone tell me what this is? What I'm outlining with my mouse? Guys, am I being...
Where? Where I can see it.
What this is. I'm outlining this. What is this?
The bone?
It's the cartilage. It's the cartilage, right? Because in the chondro, we're starting first with cartilage, guys. It's in the name. So we're starting with cartilage, right? And we said, what's the first thing that's happening? We need to destroy that cartilage with the chondroclasts. What do the chondroclasts create when they destroy part of the cartilage? They create a cavity, right? And we said that in this castle, this white part is the cavity that the chondroclasts created by destroying the cartilage. So now that they created this cavity, do you guys know what this red thing is or are? This red thing. It's red. 9 times out of 10, when you guys see histology and you guys see something red there, they're talking about capillaries or vessels. So we have the capillaries entering the cavity, the primitive body cavity. And what zone is this that we said? What zone do we call it when we have a primitive body cavity and the capillaries are entering? It's the zone of erosion. So this right here, guys, is the zone of erosion. And these capillaries are bringing in osteoblasts. And the osteoblasts would then start secreting the osteoid to make the primary bone. Okay? And as you guys can see, this is the epiphysis. So do you guys know what this area is called? If this is this is anatomy, guys. So if this is the epiphyseal part, what is this part called?
Diaphysis.
Thank you. So all of this is happening in the diaphysis, and it's happening towards the epiphysis. Now, we have our primitive bone, right? Do you guys know, like, is it okay if we just stay with the primitive bone? Like, is that perfect? Is this the end, or should something else happen? Like, our colleague kind of talked about it. Like, it's not, we don't necessarily want to stay with the primitive bone. It's not strong enough, right? We want secondary, stronger bone. So we have the primitive bone, but we need to destroy it to form the secondary bone. So we need a specific sort of cell. We said that osteoblasts, they secrete osteoid, they produce bone. And then there's another sort of cell that also starts with osteo, and it's there to reabsorb the bone. Does anyone remember what the cell is called?
Osteoclasts.
Thank you, osteoclasts. So right here, guys, in this image, we have essentially created the primitive bone. We've created the primitive weak bone. We want the strong bone. So if we want to destroy the weak bone to create the strong bone, we're going to need osteoclasts. So osteoclasts, they're going to resorb the bony spicules and enlarge the bone marrow cavity. And we know why they're doing this, because we want to create secondary bone. And I've already explained that ossification is always going to progress to the epiphyseal part. It is, however, and you guys don't know this yet, separated by the epiphyseal growth plate. This is the you have the details. It's important because there are a couple things happening here.
Katrina,
Yes?
can you like start a bit before, because you got delayed, like you got cut in between.
Oh, sorry. Where did I get? Okay. Epiphyseal growth plate. Did I get to that part?
Yeah, after that.
Okay, so epiphyseal growth plate, guys. Basically, this is the epiphyseal growth plate. It's just what's in between the epiphyseal and the diaphyseal. It's just this. However, there are some important things happening here. That's why they want us to learn about it. Epiphyseal proliferating continuously near the epiphyseal. Like it's this, as you guys can see, they're proliferating. You see a bunch of them. However, the chondrocytes that are near the diaphysis, they're degenerating. And once you actually reach and this is how you have the creation of bone, right? Because they're degenerating. So then you're gonna have the primitive body cavity, the vessels coming in, osteoblasts, yada, yada, yada. These are things happening at the same time. And as they reach to the epiphyseal parts, it's essentially gonna be replaced by bone. And this is just something that you guys should know. It's not something that's very, very, very important, but just know that a thin zone of cartilage is going to remain at the surface of the epiphysis, and this is known as articular cartilage. Now, I have a question for you guys. So I said that the chondrocytes here towards the epiphysis are proliferating a lot, and I already told you guys the answer to this question, but I told you guys that they're proliferating a lot here. If they're proliferating a lot, why isn't the epiphyseal plate changing its thickness? Does anyone know? It's because something else is happening with the chondrocytes here. Some are proliferating here, but some are degenerating here. And that is why the epiphyseal is not going to grow in thickness. Because remember, guys, I said that there are many things happening at the same time, right? We have one cartilage, part of it is being destroyed, and then bone is being built. And then part of it is being destroyed and bone is being built. The other part that had the primitive bone is being destroyed to make the secondary bone. And then here, so guys, it's all just happening at the same time. Just keep that in mind because you guys will see this on your slides. And then this is something that you guys can also see here. The proliferation zone, the bony spicules, you have the ossiform zone, osteoid zone, the zone of erosion. Here you guys can actually see the chondroclast destroying or resorbing the cartilage. And it's creating this cavity. The white part is the cavity, which will then allow the capillaries to go there and bring bone-forming cells to create the bone. Hope that made sense. And this is just an image of how it's actually going to look like in your histological side. So here's the osteocytes. What is this pink thing surrounding it? Because I already mentioned it. At what point do osteoblasts turn into osteocytes? Osteoblasts secrete something, they become embedded to it, and then they turn into osteocytes. What is this thing that they secrete, which is this pink thing? Osteoid. Guys, it's the osteoid. Remember, osteoid will become mineralized to form the bone. You guys need to know osteoid. Osteoblasts will secrete osteoid. That's the bone. And so this will be this pink thing that you guys are seeing here. And once you see cells embedded into it, you know those are going to be osteocytes. Okay, hope that made sense, because now we're going to secondary bone formation. This is basically a repetition of what my colleague already said, but we're just going to go over it one more time to make sure it sticks to your head. It is, guys, one of the easiest, if not the easiest slide for you guys to recognize will be bone. It will 100% be bone. There's no way for you to ever mix bone with something else. And that's because you guys are going to see the Haversian spaces, which look like cement lines. Once you see those cement lines, you know you're looking at secondary bone. As to how it's formed, so we said that immature bone is going to be eroded by osteoclasts, and are going to form this absorption cavities. Then you're going to have penetration of capillaries, and they're going to form what are known as Haversian spaces. In your Haversian spaces, which you guys have already seen an image of how they look like, osteoblasts will line the periphery of these Haversian spaces, and they're going to start depositing this concentric lamellae. And osteone and Haversian spaces are two words that at least in our university, our professors will often use interchangeably, like they'll use both of them, but they're talking about the same thing. Osteone is just a functional and structural unit of compact bone. So bone formation and erosion will occur simultaneously, right? I explained it to you guys. They're occurring simultaneously. We're eroding the bone and we're creating the secondary strong bone, etc. So in your slide, you'll be able to see primary bone, you'll be able to see some haversian cavities and osteon, everything appearing side by side. The concentric lamellar systems, right, are by spaces or haversian are being deposited.
Katrina, you got stuck on concentric lamellar system.
Okay, just let me know when I get stuck again.
Yeah.
So guys, the concentric lamellar systems have to be replaced by osteomes, right? And you can see the old concentric lamellae systems because they're constantly being replaced. You can see them as interstitial lamellae. And this is known as bone remodeling, and I'll show you guys what they look like. And bone remodeling is important because it's allowing the bone to be able to adapt to internal and external factors. And basically, this is it. So first, guys, I'm not even gonna try. Okay, so this is the cartilage, right? Here, number one is the cartilage. And number here, or whatever's here in this area, we're starting to have the formation of the spaces. And you can even see some like vessels, or number two is a capillary. And number three is an osteoblast, sorry. And here you can start seeing the building of the haversian canal, haversian space, and you see the osteoblasts lining the periphery of it. And in the end, you're going to have a structure like this. And this is extremely, extremely well visible. You guys will never be confused because this is literally what you guys are seeing. And this is the concentric lamellae, guys. It's like a tree, right? They're constantly being built and replaced one around the other, and this is the end result. And now just some quick information about the growth of long bones. So in long bones, you're gonna first have the proliferation of chondrocytes, at least in endochondral ossification in the epiphyseal plates, and this is going to be responsible for increasing the length of the bone. So the proliferation of chondrocytes allow for increasing the length of the bone. For growth in diameter long bones, this will occur via what we call apposition of the additional bony layers on the outer surface of the periosteal bony band. And simultaneously, you're going to have osteoclasts that are obviously eroding the interior of the periosteal bony band and enlarging the medullary cavity. This is something that, like, it's just theory that you guys are going to have to know, that they might ask you guys. You guys will not be seeing this in your slides, but know that this is how long bones grow. Length is through the proliferation of chondrocytes, and in diameter, it's via apposition into the periosteal bony band. Just remember these two: diameter, periosteal bony band; length, proliferation of chondrocytes. And lastly, I just made this really quick table for the difference between endochondral and chondral. So have been mesenteric family. And here we said that cartilage, for endochondral cartilage, is being replaced by bone, while for chondral, the cartilage is directly transforming into the bone. Ossification centers, we said it involves primary and secondary, and here there's no distinct ossification centers. Growth mechanism, the bone growth occurs at the epiphyseal centers, while for chondral, we have the expansion of the bony spicules, etc. So are there any questions, guys? If not, then I'm going to pass it on to my colleague.
Okay, hello everyone. So I'll be talking about the bone cells. So there are four major type of bone cells. There are the osteoprogenitor cells, the osteoblasts, the osteocytes, and the osteoclasts. So the osteoprogenitor cells, they basically arrive from the mesenchymal cells, and they are basically found in the regions where bone formation takes place, such as near the periosteum and the haversian canals. Now, the osteoblasts, whenever you see the word blasts, it basically means that they are the active cells which help in synthesizing of the components. So the same logic applies for chondroblasts and everything else. So here, for osteoblasts specifically, they help in the formation of the bone matrix, and the components of it, such as the collagen and other things. They are mostly found on the surface of the bone trabeculae. With the bone trabeculae is found inside the spongy bone, like the part of it, the network thing. So they are found over there, and they have a really large nucleus. Now, osteocytes, whenever you see the word cytes, it means that they are like a mature form of the blast cells. So these ones, they have long processes that connect them to each other osteocytes as well. And their main function is just to maintain the bone matrix and make sure that it has all the components it needs and everything else. These are going to be found in the spaces which are present inside the calcified bone matrix. Now, osteoclasts. Whenever you see the word clast, it means that they help in breaking down of the particular structure. So, osteoclasts, they are basically responsible for bone resorption, and they kind of like break down the bone tissue when it's required. They are present in the Harshdeep lacunae. Now, these Harshdeep lacunae are like small spaces which are found on the bone surface, and they are only present when the bone is going through resorption. Now, these cells are multinucleated and they are pretty large, and they have kind of like a irregular border because it makes the process of bone resorption way faster. I'm going to be talking about fracture repair. So, what happens when you basically have a fracture? So, first step is going to be Yeah, okay. So first step is going to be the damaged tissue is going to the macrophages from your immune system are going to come and attack the damaged tissue, which will remove all the blood clots and the matrix and everything is going to be removed so that both the ends of the broken bone are like cleaned off. And after that, the osteoprogenitor cells will arise and they will proliferate rapidly between the broken ends of the bone so that they form a kind of like a tissue. And after that, the normal bone formation will take place, endochondral ossification will happen, intramembranous ossification will happen, and the primary bone tissue is going to be formed between both of the ends of the broken bone. This tissue is going to be called bone callus. That is a very important term which is going to be used. And after that, the bone callus undergoes remodeling, the osteoclasts come into place, and they form the mature lamellar bone. Does anyone have any questions about this? All right. So, to summarize again, after you get a fracture, the macrophages will come, they will act. As you can see in slide A, they're going to be osteoprogenitor cells will come into play and they will form a tissue-like structure. Then in B, you can see this tissue-like structure is being formed over here. And in C, after the bone undergoes ossification, it is going to form a primary bone, which is called as the bone callus. And then in D, you can see that the proper bone is formed, and after a few months or whatever, all the vessels and all will come into the bone again, and it's going to be functional again. Now, the basic function of bone, as everyone knows, it forms like the basic framework of our entire body, and it also helps in protection of our internal organs, such as the thoracic cavity protects the lungs and the hearts, and as well as the brain is protected by the skull. Another function of the bone is that it stores 99% of the body's calcium. Does anyone have any questions about everything I've explained so far? All right then. Varun, you can go ahead.
All right, I'll just stop the recording.